Chapter 9, Conduct Disorders, Part 1. According to the Diagnostic Statistical Manual, conduct disorder is characterized as a wide range of antisocial behaviors, aggression, theft, vandalism, fire-setting, truancy, and running away. Individuals violate social norms, rules and regulations, actions against people and property, fighting, lying, stealing, property destruction. But in most children, these behaviors will decrease in intensity. Conduct disorder is often difficult to distinguish from other disorders, especially juvenile delinquency, which we associate with gangs and criminal behavior. The first video in this chapter talks about conduct disorder and the characteristics. Covert behaviors are more difficult to assess because we cannot always see them. Overt behaviors we can see. We talk about coercive relationships, coercive exchanges with parents. A child whines, the parent ignores. The parent asks something again. The child responds with whining. It escalates, parents become more punitive. The child continues to act out, leads to child abuse because the behaviors escalate. Parents become angrier and more punitive. Many children with conduct disorder are seen as having also oppositional defiant disorder and attention deficit hyperactivity disorder. Caution. Sometimes we have difficulty distinguishing between pathological behavior and cultural mores. Very, very difficult, and we have to be cognizant of this. Remember, conduct disorder is a psychiatric disorder, and many believe it's not a school issue. Bragging, swearing, blaming others, talking back, disobedience all lead to juvenile delinquency. Some children demonstrate both overt and covert. These behaviors will lead to juvenile delinquency unless we take some responsibility and we try at least to do some intervention in school. In our society, children are exposed to brutality, assault, disruption, poverty, property destruction, violence, weapons, and a lot of this occurs in school. Socioeconomic status, living in poverty, violence, lack of quality educational services. Sometimes parents, the personal, social, and family contexts provide background for these behaviors. If the parents have poor management skills, unskilled in using reinforcers and consequences, and if there are many family conflicts, especially within interactions among family members, the children are at risk for antisocial behaviors. This is a generalization, but oftentimes true. So, for this part of the recording, for this part of Chapter 9, in your groups, you are to respond to the following. Should children who have been diagnosed with conduct disorder be classified? Do you believe a student with conduct disorder, social maladjustment, should be classified EBD and provided with an education or not? And since many consider these students juvenile delinquents and will wind up in jail anyway, discuss this in your groups and explain your rationale. In addition, you are to watch the first video. These videos are listed on the last slide of this PowerPoint. This video talks about the characteristics of conduct disorder. In your groups, come up with a talking point and discuss. Have any of you ever had experiences with children with some of these characteristics? What has the school done? What have you done to intervene? And ask a question also based on the content.